Welcome, dear viewers, to our Nature Medicine video. Today, we have prepared something very special for you. We are talking about so-called gold implants. We have already shown in a wave of educational videos how important it is to prevent operations on the knee, hip or ankle stiffening. We want to show you how effective gold implants are. So stay tuned. Here we are again. Now I can also show you my guest, Dr. Med Harald Burgard. Welcome, dear Harald.
Hello, Alexander. Good morning.
On the other hand, I would like to welcome Hans-Josef Austgen as a patient. Welcome, dear Mr. Austgen.
A wonderful morning.
With pleasure. I would like to start with you, dear Mr. Austgen. You have finally got to know gold implants as a patient. But I would like to know what your health problem was and what ways you have looked for to get out of this valley of pain.
To answer this question, I have to send you something in advance. I have never really appreciated my health. I was self-employed for many years. I have missed out on things that might have led to these pains, which ultimately came about in my knee joints, that I could hardly walk. Climbing stairs was a single torment. Kneeling down, tying shoes, all that you have to do every day, or picking up something from the floor was almost impossible. Since I was in treatment with Dr. Burgard for another matter, I came across it some time ago, but I avoided it for a long time, because I was not necessarily aware that it was really supposed to work. So I thought about it. And then something happened. I was at home in the early afternoon and saw an animal show. I think it was from the circus, Hagenbeck. There was a report in it that an elephant was treated with a gold implant for severe knee arthrosis. Since I'm not exactly a lightweight, but since it works with an elephant, it definitely works with you too. And ultimately gave me the last push to go into medical treatment. I have to tell you, I was self-employed for many decades. In the last 2 years, now that I'm retired, I've been with doctors more than in the 51 years before, as long as I was employed. That was a short trip when it came to my illness or my pain.
If you look at the pain scale now, 0, no pain, 10, extremely, the tears run. What was your pain level before you went into surgery?
So there were no persistent pain, but I would guess around 8. I can withstand pain relatively well, but it was just unbearable. I have traced it back to, in the first place, my many years of playing football, tennis also, which is not so good for the joints. But there was no way around it, I just had to do something. Orthopedics couldn't help me. I have not made any major attempts to bring relief, I have to admit. As I said, I suddenly came up with it. I hesitated for a long time, for about 3/4 of a year. I was already in treatment with Mr. Burgard, and then I said to myself, now you're going to try it out. After this show, it can't get any worse. It can only get better. And I have to admit, if I had known what a great success that would be, I would have had both knees done. So I'm already thinking whether I should get under another knife, or, that wasn't a big thing, and have the other knee treated, although that's not as bad as the right knee.
You were lucky to have seen this show and to have been treated by the doctor who was actually the pioneer of these gold implants within Germany at all, used and spread across his academy. You were really lucky. But now let's get to the surgery. How was that? How long were you under the knife? How do you have to imagine that? Was that a big bloody story? Or was that just ambulant?
Well, I was told that it could be painful, maybe it would be. I was in good care. There were two wonderful ladies next to the doctor. One of them held my hand, cautiously, so that I couldn't run away. No, that was a joke. But I was really lucky. There was only one time. I think there were 9 stabs.
There were 18.
18? There were 18.
18? Okay, yes, as I said, I can only say with one, that it really hurt. But everything else was easy to bear. So as I just said, I would do it again immediately. The only thing that annoys me is that I didn't know that 5 years earlier, and did it 5 years earlier.
Yes, and that's why it's so important that we listen to you now. Because you really make an important appeal to many people who are already in pain, but actually only have one alternative knowledge, namely pain pills or an orthopedic operation, i.e. a new joint. And that's exactly what we want to prevent a little bit with this educational broadcast. Now again, the operation went for one knee for an hour, maybe?
So I would say at most half. But I have to say I didn't have a good feeling for time, but it went very quickly.
Good, and then you could go home again?
Of course. I was just lying there and then I got up, could walk, that was no problem at all. It didn't hurt me afterwards.
What?
I got into the car, drove home. So all the best.
So I've never heard that before. That means after the operation you didn't have any more pain.
No, I didn't have any pain due to the operation.
Oh, maybe because of the anesthesia. The local one. How did the healing process go? Did you get pain again, or did you not get anything at all?
So I have to be honest, every now and then, I do notice a slight pull in the knee. But as I said, for my part, I can only say that it is no comparison to what it was before. I still have my problems with my left knee, and I was at a birthday party last night that took quite a while. And while I was sitting there on the bench, I had to realize several times what kind of problems I have with my other knee, how often I had to stretch and pull my legs, because of the pain from sitting in the same position for a long time got worse and worse. And I don't have any more of this problem with my right knee. Everything is so great. So I can only tell everyone who has any problem to not be afraid of costs and to really undergo this treatment. I don't think there is anyone. Of course, there are always cases where a treatment doesn't work for someone. But I can hardly imagine it.
How long has it been with you that you are so full of juice again? Painless?
Oh, now I have to think carefully. So I think it's been about 2 years.
Okay, great. Now I would like to ask the doctor quickly. Dear doctor, Harald Burgard, it is unusual that someone has no pain after the operation. Because as I learned from you, it is a process where the inflammation and the pain are reduced by the running electrons that switch over from the gold implant to reduce this inflammation process.
Yes, it is in fact the case that the patients are painless right after the operation, because the anesthesia is still there. Most of the time, the pain comes back, of course, and then in the course of weeks to months, more and more go back and then either stay away completely or simply to a minimal. By simply releasing these cells in the connective tissue, the mast cells and others from the gold ion, which then prevent that inflammatory substances are formed. That is the process. But what we also know, what is very exciting, it also leads to the fact that new vessels actually burst in, that the circulation gets better. A bad circulation also causes pain in the tissue. And what is even more important, that in the case of gold implantation, stem cells are attracted. These are cells that perform repair processes, and up to 5 times more than usually in a tissue that is damaged. This also explains regeneration processes again and again, which we also see in spinal canal stenosis, that they are suddenly gone after a while. It takes a while until such a process has been implemented. But that has been proven in studies, and that is super exciting and also fits what we see in the clinic. And what Mr. Austgen just said, it's not a lightweight. So we actually have comparisons between patients who are normal weighted to very heavy weighted patients, because we wanted to know whether the gold implantation in both brings the same results. And statistically, there is actually no difference. That amazed me. I thought it might actually be that the gold implantation in people who are very heavy may be worse. But there is statistically no significant, so no notable difference.
That's amazing. But I do believe that biochemistry is the same in the knee, even if the load is higher. But ultimately, the biochemistry is the same. Against inflammation. Absolutely. That's what Mr. Austgen did with the knee. Where else can you put such gold implants to achieve the same result?
You can put them on all joints, starting with the ankles, knee joints, hip joints. Shoulder is very, very grateful. You can also put them in thumb joints. You can also put them in smaller joints. Then, of course, you take smaller pieces up to pulverized gold. You can of course also treat the entire spine. So if someone has spinal canal stenosis, which is painful, or if someone has a facet joint arthrosis, after a herniated disc accident or fractures, with fractures caused by osteoporosis, their inflammation can occur. And you can stop this with the gold implant, or significantly reduce it.
Dear Harald, I just get sick in such things. Sick in the sense because I now know that something like this works. And on the other hand, there are hundreds of thousands of people who have to live with pain, even with orthopedic operations, have pain and have to live with it. And there is a possibility that no one knows about, except veterinary medicine. The vets know.
Yes, well, they've known it since 1975. Indeed, and many veterinarians, many vets know that. When I came home with it, back then, and I told my wife, who is a vet, she said, yes, of course, I've known it for a long time.
Yes, great. You didn't get a bonus.
Never mentioned a word of it.
Wonderful, wonderful. Yes, dear Mr. Austgen, maybe another question. You may also plan to have a second knee done. But have you already had these amazing questions with colleagues, friends, family, how you can now be pain-free?
I've told that a lot. I've done a lot of big ads, no matter who I met, whether it was in the tennis club or elsewhere. I even plan to start again carefully with my former partner in tennis, but of course with caution, because I don't want to risk anything, because I don't need these pains anymore, which I once had. And yes, I'm very happy with the result. And I can only recommend to everyone who sees this show, please continue to spread the word so that unnecessary pain does not have to be endured. I've been tormented by it for a long time. Of course, as a self-employed person, you don't always have the feeling for what is important. But I can only say I would do it again immediately.
May I ask you another question? Did your health insurance pay for anything, or did you have to pay for it yourself?
I paid for it myself. I didn't even try to pass it on to the health insurance company, because I was of the opinion that Dr. Burgard would agree that the health insurance company would not take it. That's why I didn't even try.
Okay, maybe this indiscreet question, that was a knee operation. Maybe I'll ask you, dear Harald, what about the prices? If we don't talk about what it would cost, then thousands of people will write to us. I would like to prevent that a bit. In which range are we talking about? On one knee or on two knees?
We only treat one major joint, because I need so many anesthetics that I can't treat a second one in the same session. The prices are around €2,300. Not quite. It also depends a bit on the gold price, but between €2,250 and €2,300.
That's absolutely okay for a painless knee. That doesn't bother me at all when I hear that.
That also applies to the spine. That's for one intervention. And legal health insurance companies usually don't cover the costs. Of course, we have often seen that in the private sector that they cover it completely. Some don't, but that probably depends on the person responsible. You can never predict that.
So try.
In Germany, you can at least make the costs taxable if you are employed. But if it's a medically necessary intervention, in Switzerland also. But if I compare it to the costs that arise from a joint implantation with a rehabilitation and so on, then we are easily tenfold. That the health insurances cover. But that's just a tedious discussion, also with many other things where we can help. That the health insurances cover a part, cover nothing. You can't know.
But this therapy form is not somehow in the critique of school medicine. They just don't know it, right?
It's not in the critique of school medicine. There is of course still university research on this. Research is also being carried out in Denmark and the USA. But you don't really take it seriously. You don't really have it on your radar, because the mainstream is quite clear that you first do the pain therapy, then movement therapy, strengthening therapy, and so on. If all of this doesn't work, then you talk about implantation, and then you either do a partial prosthesis or a full prosthesis on the knee or on other joints or stiffening at the spine. That's state of the art. That's the usual procedure. But an orthopedist who doesn't know this procedure, as we do it, he won't even get the idea, because it's just not on the radar.
And these painful stories of hip operations, I'll tell you, the effort of operating a hip joint. So if people have pain in the hip, then, as I have now also understood, don't wait too long. Get this implant quickly, right?
Yes, he just said it doesn't really hurt yet. He still wants to wait. It's like this, if a joint is damaged, then at some point you get into the protective posture and then the musculature shortens, the capsule that surrounds the joint pulls something together, then people can't get their knees straight anymore or their hips can't be straight anymore. They can't lie in bed straight anymore. This is called a capsule pattern. The sooner you get a gold implant, the more you can avoid these things. Of course, you can, if the pain is gone later, normalize or significantly improve it through physiotherapy. But that's the case with everything. The sooner you intervene, the easier it is, the faster it works, and the fewer side effects you have.
Now I keep hearing, if something is really broken, you can't fix it anymore. You have to replace it. They say the hip joint is broken or the knee is broken. It's bone to bone. And now I have to operate. But that's not true, is it?
Well, that bone is on bone is indeed the case in extreme cases. Most of the time it is the case that the cartilage is thinned or partially gone. But that's not the primary problem, because the cartilage and the bone do not have pain fibers. That means it doesn't hurt if they rub against each other, but the pain stimulus comes from the joint capsule that surrounds the joint. And if I don't put gold into the joint now, but around the capsule, then I take the pain stimulus by causing the gold to act against inflammation and swelling permanently. And with that, the person can move their joint again. They can walk on a joint where the cartilage is broken. That's not a problem at all. Not a problem for decades. There are limits. If the bone is destroyed, if there are large rolled cysts, as they call it, or a hip necrosis, then of course we would never do a gold implantation, but hand it to the surgeon. So there are limits. But these are very rare cases. In all other cases, in most cases, you can actually do pain relief without any problems or even achieve pain freedom and almost normally strain your joint.
I didn't know that either. Because exactly what you just explained so beautifully is considered impossible in the public eye. They always say bone on bone causes pain.
I just said what we also see, which was also proven in Thailand, for example, in studies and also by colleagues who work there at the university, was proven that if the gold is sitting there, gold also causes stem cells from the bone marrow through certain stimuli and, as I said, up to 5 times more than you usually have. This means that stem cells migrate into a tissue and lead to regeneration there. So there can also be regenerative improvements, so that the bone may even rebuild in parts. We see from the results that Mr. Kierkegaard has already made since 1983 that people have been able to be pain-free for decades. We see that too, my colleagues see that with patients, that they are permanently pain-free.
Yes, dear Mr. Austgen, I don't want to use your time any longer. I really want to say thank you 1,000 times. Because it is so valuable for people affected to bring such voices as you do. Because you are authentic, you have experienced it and don't want to sell anything. You are as you are and have suffered. And have found a solution. Thank you for sharing your opinion with us.
Yes, nothing to thank for. It was a need for me that maybe on this path many people can be helped. I would like to thank Dr. Burgard again for the great treatment. And to you I wish success with the program.
Yes, thank you very much. I wish you all the best, dear Mr. Austgen. Take care.
Thank you.
All the best.
Bye.
Bye. I have the final question now, dear Harald. If a viewer says that they are interested, do they get this service and this type of therapy everywhere already? Or where can I find them?
So at the moment in Europe there are 6 or 7, maybe even 8 doctors who do this. So we are a relatively small circle. There are therapists all over the world who offer something like this. But they are few. But we are also driven, when Corona is over, to take more people in.
Good. So at the moment it's just Germany, Austria. Is there a therapist in Switzerland?
There is also a therapist in Austria. Is there a platform where we can find these people so that we can discuss this medical advice with a doctor? I said in another film that there is the term gold implantation for people. There is the Ackermann group. This is a group consisting of volunteers who thought it was great, who also had success as patients and who are trying to bring the studies together. You can find other therapists on the platform who offer this.
Good. And otherwise just a search term on Google, probably gold implantots. Gold implantation. Good. I can only hope that you can still train thousands of doctors through your academy. Yes, it's true.
We were extremely out of control due to Corona. Nothing worked. I hope that this will not happen again in the fall. But as soon as everything is normal, we will also start to train colleagues in this area.
Yes, that is extremely important. Extremely important. So I was looking in Switzerland. I haven't found anyone who has already offered this. But at least at the border in Konstanz there it's already starting. I can only say it's fantastic. Dear Harald, thank you for offering this kind of service and also introducing us to this credible patient. Really cool. And I really wish you a lot of success on this path.
Thank you very much.
Likewise. And dear viewers, I can only warmly ask you to please send this show to those people who are currently having any problems in the area of the knees, the hip, the shoulder, or the back. And remember, if you do it early, then the suffering is not that great. And if you wait too long, then it is also unpleasant, because the healing process also takes longer. Think about it. Let's just clarify whether a gold implantation would be a blessing in your case. And please look for a doctor, a therapist who is familiar with it, who consults with you and shows you a way. I wish you all the best. Until next time and take care.